Good day everyone, my name is Kenneth D. Velasquez, a student nurse from Davao Doctors College. And today I will be performing my last written demonstration for this semester, which is assessing the cranial nerves. This assessment is important because it provides information with regards to the transmission of motor and sensory messages, primarily to the head and neck. So first, let's start with the pre-introductory phase. First, we must review the medical records. So I have here the doctor's order sheet, which is the yellow sheet, and it was aforementioned that my patient is having his first assessment, which is the cranial nerve assessment for today. So after determining the scope of the assessment, the materials that we are going to use in these assessments are, of course, we need to have the copy for the olfactory assessments, of course, the Snellen charts there, and of course, the pen lights. Next is we will be having the cotton tip applicator, and so of course, do not forget to have the tuning fork, and so of course, do not forget also to have wooden tongue depressor. So completeness and organization of our equipments ensures our efficiency as nurses. After that, perform hand washing for us to deter the spread of microorganisms. So after verifying the need in performing the assessments, of course, after performing hand washing, we can now enter into the patient's room, as you can see, and proceed with the introductory phase. So in the introductory phase, first we need to greet the clients politely. Okay, sir, good day. My name is Kenneth D. Velasquez, your student nurse from Davao Doctors College. And of course, sir, before we start, may I see your wristband, please? Can you please tell me your full name, sir? How about your birth date, sir?
September 21, 2011.
So that is the two identifiers. So thank you for that, Sir Sebastian. So how would you like me to call you, sir? Okay, so Sir Basti, how's your day going so far?
It's okay.
That will be nice to hear, and I really hope that our day will end up a good one. And of course, this procedure is important because it connects you to your patient and can improve patient's care. Of course, second, explain the procedure to the clients. So, Sir Basta, since you will be having your cranial nerve assessments, of course, as you can see, this material, so we are going to use all of that later. And as you can also see the Snellen charts, so parts of your body, especially your back, will be exposed, and I will be asking you to open your mouth, and I will be asking you to do some facial expressions, and also I will be using this pen lights in your eyes, sir. Would that be okay?
Yes.
So do you have any other questions?
No.
Any queries? Okay, so thank you for that. And also, explaining the procedure to the clients can help reduce anxiety and enhances cooperation. So third, we must secure the privacy of the patients. So what I'm doing today, sir, is that I'm closing all the curtains and securing the doors, and I'm making sure that the assessment is safe, secured, and free from distractions. Of course, sir, are you seated comfortably there?
Yes.
Okay. So after that procedure, of course, privacy is important because it involves protecting the patient's integrity. So after all of that, we are now in the working phase. So here we will be assessing the cranial nerves. So first, let's proceed with the first cranial nerve, which is olfactory. Okay, sir, so now we'll be assessing your olfactory. First, sir, is that I want you to sneeze, sir, for this assessment. Sneeze, sir. And then throw it in the garbage. Do you want to use any alcohol?
Yes.
Okay. So what I want you to do, sir, is that since this is olfactory, I want you to close your eyes first, sir, and then occlude one nostril. Okay, so I want you to identify the thing, sir, from the sense, okay? Okay. Can you please tell me, sir, what is this?
Coffee.
Okay, that would be correct, sir. And I'm going to throw this one here. And it's okay, sir, go back. So my patient has normal olfactory nerve, but if you encounter patients with inability of smell or was not able to identify the correct sense, the patient has, of course, anosmia. So the second cranial nerve is the optic nerve, and let's start by checking the visual acuity for us to check how well a person can see the details of a letter or symbol from a specific distance. So, Sir Baste, as I have said earlier, we will be using that Snellen charts. So for us to do that, you must distance yourself 20 feet away first, okay? So can you please position yourself here? Here, sir. This is 20 feet. Okay. So the instructions for this assessment, sir, is that I need you to read this Snellen charts from top to bottom, okay? So the farthest letters can you read, okay? So first, you must read with your left eye, closing your covering your right eye, and then your right eye covering your left eye, and then read this Snellen chart with your both eyes, okay? So sir, can you please start reading while covering your right eye with your... Okay, start, sir.
E F E D O Z F E E D B E C F D E D F Z Z Z B F E L O B C D D E F E O E C.
Okay, sir, so that will be 20 over 20, which is normal. So how about the opposite side, sir? Can you please read that one? Go, sir.
E F E D O Z F E E D B E C F D E D F C C C B F E L O B C D D E F E O E E C.
Okay, so that is also 20 over 20. Your left and right eyes are both 20 over 20, which is normal. Okay, sir, so can you please start reading this one with your both eyes?
Yes. E F E D O Z F E E D B E C F D E D F C C B R F E L O B C D D E F E O D E C.
Okay, sir, perfect. So your both eyes is 20 over 20, your left is 20 over 20, and your right is 20 over 20. So that will indicate, sir, that you're having a normal eyesight, okay? So for you to be informed, sir, the first 20, which is the numerator, is your distance from the Snellen chart, which is 20 feet. And the second 20, which is the denominator, indicates the normal range a normal person can see, sir, okay? So do you have any other questions so far? Okay, thank you very much, sir. You can now go back here. Next, we need to test for visual field for us to determine the function of the retina and neuronal visual pathways to the brain and the optic nerve. Okay, so Sir Baste, what I want you to do now is that I want you to say yes if you will be seeing my fingers move, okay? So can you please cover your right eye for me? And then I'm covering this one. Please focus your eye in my head, okay? So can you please say yes, sir, if you see this move, okay?
Yes. Yes. Yes.
Let me try this one here.
Yes. Yes. Yes.
Okay, so let me try, let me test the opposite eye, sir. Cover that one. Okay, let's start.
Yes. 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 Yes.
Okay, sir, thank you for your cooperation. So, of course, when looking straight ahead, the client can see objects in the periphery. So, temporarily, peripheral objects can be seen at right angles, 90 degrees to the central points of vision. and the upward field of the patient's of vision is normally 50 degrees because the orbital ridge is in the way. And of course, the downward field of vision is normally 70 degrees because the cheekbone is in the way. And of course, the nasal field of vision is normally 50 degrees away from the central points of vision because the nose is in the way. So, after that, let's proceed with the assessment of the third, fourth, and sixth cranial nerves, which is the oculomotor, trochlear, and abducens nerves. So first, we must inspect the position of the eyelids and the pupil. Okay, sir, can you please look at me here? I'm just inspecting your eyelids and your pupil. Your pupil are both circles and rounds, okay? So as I can see here, his eyelids did not obscure the vision, and the pupil of the patients are both rounds and equal in size. So second, test for the pupillary reaction of the patients. Of course, Sir Baste, we are going to use the pen lights now. And would it be okay, sir, if I dim the lights for the assessment?
Yes.
Okay. Okay, sir, I just want you to focus your eyes in me, sir, okay? I just need to test your pupils. How about the other? Okay, sir, so it constricted, which is normal. So, of course, for the direct response, his pupil constricts, which is normal, and for the consensual response, the other pupil constrict even without the exposure of lights. So, of course, third, observe for the pupil dilation. So, of course, sir, we have assessed the constriction a while ago, so now we'll be assessing the dilation. So first, sir, I want you to focus on this one, okay? But let's turn on the light first. Okay, sir. Focus here, and then as I move this one. Okay. So the normal findings for this assessment is that as I moved my finger farther the vision of the patient, his pupil dilated, which is normal. So lastly, we will be checking for the extraocular movements for us to determine eye alignments and coordination. Okay, so Sir Baste, right now I want you to stand, okay? Would that be okay? Just stand here, sir. Okay, sir. So the instructions for this assessment is that I want you to follow with your eyes only my finger, okay? Without moving your head, sir. Would that be okay? Can I start now? Okay, sir, thank you for that. You can now sit there. So, for that assessment, my patient is normal, but if there is a constant misalignment from its axis, that will be strabismus. But if there is a rapid involuntary rhythmic eye movements other than at endpoints, there is nystagmus. So next, let's proceed with the fifth, the cranial nerve, which is trigeminal. And this is the test sensations of pain, touch, and the temperature on the facial skin. So first, let's test the pain of the patients. So, sir, I will be using this cotton tip applicator in your face to assess the pain. So, I want you to tell me, sir, as I have struck this cotton tip applicator on your face, I want you to tell me if you feel any pain or not, okay? Okay, so can you close your eyes for me, sir? Do you feel any pain? How about the left side, sir? Do you feel any pain? Okay, thank you for that, sir. And second, that test for the light touch. Of course, same procedure, but we will be using the cotton as a light touch. Okay, sir, same procedure. Close your eyes and tell me if you feel any pain, okay? How about in the left side, sir? Do you feel any pain? Okay. So, thank you for that, sir. Lastly, we will be checking for the corneal reflex. And this assessment, sir, I want you to be close with me, please. I will be testing your corneal reflex, sir, of course, using this cotton, okay? So, can you please look upward? And then, I'm going to start in the side, okay? Okay. So, my patient's trigeminal is normal. But if you will be encountering patients that has a severe stubbing pain to one side of the face, that will be the trigeminal neuralgia. So, after that, let us assess the 7th cranial nerve, which is the facial nerve. Okay, sir, so this is the facial nerve, okay? So, in this assessment, I want you to stand up there, okay? As we did earlier. So, in this assessment, sir, I want you to follow me, sir, okay? So, can you smile for me? Can you show your teeth? Can you frown for me, please? Can you puff your cheeks, sir? Can you purse your lips? Can you raise your eyebrows? So I'm going to touch your face, sir, okay? Can you close your eyes? Okay. So just over here, sir. Go back here. So my patient has a normal facial nerve because he can do facial expressions easily. But if you will be encountering patients which muscles on one side become weak or paralyzed, they are experiencing palsy. So next, let us assess the 8th cranial nerve, which is the acoustic or vestibulocochlear nerves. So for us to determine if the patient has a normal hearing and balance. So of course, first we need to assess for hearing. And of course, sir, I want you to sit here, sir. Okay, sir, so would it be okay if I cover in this one here? So I want you to tell me, sir, or repeat the word that I will be whispering, okay? Okay, sir, so let's test this one. I'm covering this one, okay? Same procedure, please repeat the word that I will be whispering, okay?
Laptop. Notebook. Listen.
Okay, sir, thank you for that. So just remain there. So, if your patient identified 3 out of 6 whispered words, that is considered passing the test. So, of course, second, that assess for the lateralization by performing the Weber's test. So, in this procedure, sir, I will be using the tuning fork. So, what I want you to do, sir, is that please stand up. I'm going to adjust this one. Go back, sir. Go back sitting. So, I will be using this tuning fork, sir, okay? So, in the Weber's test, I want you to tell me if you feel or if you hear the buzzing from the tuning fork in both of your ears, and if you can feel the buzzing in your mid-head, okay? So, I will be starting now. So, the tuning fork is like this. Okay, so normally sound is heard in both ears or is localized at the center of the head or an indication for Weber negative. So lastly, we will be performing the Rene test for us to compare ear and bone conduction and to assess for hearing loss. So a while ago, we have performed the Weber test, sir. So now we will be performing Rene test. So in this procedure, sir, I want you to tell me or to compare which sounds is heard louder, sir, okay? So in the parts A or in parts B. Okay? So can I start now?
Yes.
Do you have any other questions?
No.
Okay. Parallel. Parts A or parts B?
Part A.
So, of course, normally, air-conducted hearing is greater than bone-conducted hearing. So, of course, we are now ready to assess the 9th and 10th cranial nerve or the glossopharyngeal and vagus nerves. So, for us to check the position of the uvula, to check the gag and swallowing reflexes, and to test posterior third of tongue for taste. So, of course, both cranial nerves are tested in common since they both innervate muscles of throat and mouth. So, of course, first we need to ask the patient to say ah and assess the patient's voice. Okay, sir, would it be okay if you transfer here?
Okay.
I want you to open your mouth, sir. Say ah. Okay. So it is not hoarse and it doesn't have nasal quality, which is normal. So second, let us observe the soft palates and the uvula. Okay, sir, I want you to open your mouth again for me, please. Open wider, sir. Okay, go back. So as I can see here, my patient's soft palates rise promptly and symmetrically, and the uvula remaining in the midline. So next, let us inspect the anterior and posterior pillars and pharynx. Okay, sir, I want you to open your mouth again for me, please. Can you stick out your tongue, sir? Okay. So it is normal. Second, we need to test for the gag reflex, one side at a time. Okay, sir, so in this assessment for the gag reflex, we are going to use this wooden tongue depressor, and I'm going to stick this one in your mouth, okay? Would that be okay?
Yes.
Okay. Do you have any other questions?
No.
This is sterilized, sir. Okay, sir, so can you open your mouth for me, please? Open widely, sir. Stick out your tongue. Okay, so as you can see earlier, my patient has a normal gag and of course the swallowing reflexes. Okay, sir, can you please swallow for me, please? Okay, as you can also see, my patient has normal swallowing reflexes. So next, let us assess the 11th cranial nerve or the accessory nerve for us to check the strength of sternocleidomastoid and trapezius muscles by asking the patient to rotate his head and shrug shoulders against resistance. Okay, sir, I'm going to throw this one in the trash bin. So in this assessment, sir, I want you to sit down here, please. Okay, sir. I want you. Would it be okay, sir, if I take out this gown, sir?
Yes.
Okay, sir. So what I want you to do, sir, is that I'm holding this one. Can you shrug your shoulders for me, please? Okay. So can you do a little pressure? Okay. So next is that I'm going to test your head, sir. Okay. Please look left. Okay. Look at the right side, sir. Okay. Why are you laughing, sir? Do you have any other questions?
No.
Okay. So thank you very much, sir. And I'm going to fix your gown. Why are you laughing, sir? Okay. So, of course, muscle strength is characterized by ratings from 1 to 5 and classification from paralysis to normal, as you can see in the table here. So lastly, of course, this is the last assessment, sir. we will be assessing the 12th cranial nerve or the hypoglossal nerve for us to note any deviation in position. So first, we need to ask the patient to open his mouth. Of course, sir, can you please here? So again, sir, I want you to open your mouth for me, please. So, as I can see here, his tongue is free from atrophy and fasciculations. So next, ask the patient to stick his tongue out. Can you stick your tongue out, sir? Open your mouth and stick. Okay. So as I can see here, his tongue protrudes straight out and free from asymmetry and deviation from midline. So of course, here we are done in the assessments. So for us to conclude the assessment, we must inform the clients the assessment is done, do aftercare, and perform hand hygiene. So good day, Sir Baste. Thank you very much for your cooperation and for your jolly experience with the assessments. So far, sir, you have a normal findings with your cranial nerves, sir. Okay. So do you have any other questions? Do you want to drink water?
No.
Do you have any queries?
No.
Okay, thank you so much, sir. And of course, I will be having my hand washing for us to deter the spread of microorganisms. Okay, sir. I'm back. And of course, we need also to document the findings and report deviations from expected or normal findings. Are you okay, sir?
Yes.
Do you have any other questions again?
No.
Okay. So, after that, without further ado, my assessment is done. Again, I am Kenneth P. Velasquez, a student nurse from Davao Doctors College. Thank you very much for watching. Goodbye!